Mr. Jing Zhu. Okay, I know who it is. So, I'm writing to refer urgently. Well, I would say urgently refer. Okay. Um,
I can't see. Anybody can't see? Ah, yes. Thank you.
okay. I'm writing to urgently refer Mr. Jingzhu, a 72-year-old known case of CCF with exertional angina on yesterday for management of ischemic heart disease. Okay.
And it is the case note of number 20.
I know. With exertional angina on what? I don't think we need on.
Yesterday.
Do we need to say
Maybe.
yesterday?
Yes,
Yeah.
we referred
Uh,
today.
is it? Should we say since yesterday or?
Because
No, yesterday.
he had one episode of angina.
Okay. So why are you referring then?
To management of ischemic heart disease.
So he just had one episode of angina.
Yes, yesterday. I
Okay.
think in the case.
Okay. Right. So I would say probably you don't actually need this. I think you just say angina. And do we need to say known case of angina?
A non-case of CCF.
Cystic fibrosis.
No.
Yeah.
Congestive cardiac failure.
Cardiac failure.
Right. Okay. A known case. What do you think about a known case? Is that a case or a patient?
Patient.
Okay, thank you. So shall we say a 72-year-old gentleman?
Yes.
Okay. Okay. So Mrs. Zhu came to see me today for 10-minute episode of angina for a 10-minute episode of angina after mild exertion on yesterday. We don't use on for yesterday. On examination, his JVP is okay. So it was came. Now, why do you say is? Was 4 centimeters. ECG has some ischemic changes anterolaterally. 2 weeks ago, he had come to see me for angina on exertion and gardening, while gardening. Okay. And not activity, okay. And ECG had some. The ECG showed or had, okay. The pain had been recovered or had recovered with rest and anginin. His JVP was 3 centimeters and he had orthostatic hypertension. The diagnosis was a stable CCF, okay, and angina, okay. 4 days ago, if you write a number at the beginning of a sentence, you use letters, not numbers. He came to see me again with increased dyspnea, okay, and increased ankle edema, okay. I'm too picky. And chest pain. His JVP was 6 centimeters. If you put a space, it counts as 2. So I just remove these. The diagnosis was deteriorating CCF with unknown cause. I increased the dose of Lasix to 80 milligrams daily. Could we use another sentence instead of this?
The Lasix doses was increased.
Okay. And that's, is it important who increased it?
No.
No, the
Okay.
action is important.
Yes, so the dose of Lasix uh, um,
Was
was increased, was increased to 80 milligrams daily. Mr.
that
Zhu, yes.
the upper line we have two increased. I think one of them is enough. Increased dyspnea and ankle edema. Do we need to increase?
Increased dyspnea and, uh, yep, um, ankle edema, okay, and chest pain. So we actually need to just put a comma here, ankle edema and chest pain. Mr. Zhu has a history of hypertension, ischemic heart disease. You're writing to a specialist, aren't you? So the specialist would probably know what IHD is, and has no significant family history. He doesn't smoke. Based on Mr. Zhu's symptoms and signs, it is likely that, okay, he has ischemic heart disease. We know he has ischemic heart disease. We need something else here. What is your suspicion that he has what?
Suspicion is ischemic heart disease.
You know he has ischemic heart disease, but he has.
Deteriorated.
Okay.
Ischemic.
Okay. Or he now has unstable angina. Yeah.
Yes, but it is not in the case note. Are we allowed that write unstable angina?
Okay. So shall we say he has exacerbated ischemic heart disease?
Yes.
Yeah. Okay. It would be highly appreciated if you could see him for further management, not of it, okay? For the management or for further management. Right. Okay. Good. I would probably write this a little bit differently, but this is, yeah, I think the format is good. And you have 181 words, okay? I mean, the content, I think, is okay. I don't agree too much with this JVP thing, which you have written 3 times. So 4 centimeters, 3 centimeters, 6 centimeters. What does that mean? Is that helpful or?
I don't know. Not
And
necessarily.
The severity of the condition, Dr.
Heart failure.
Severity of, yeah,
Um,
heart failure.
okay, is that an indication of severity?
No.
No.
Okay, and I don't remember orthostatic hypertension. I remember it was orthopnea was mentioned, but not orthostatic hypertension. I can't remember that. And when you started Lasix, when you increased Lasix, was he better?
No, because he has, for example, angina after the starting Lasix.
Okay, but how about his shortness of breath? Didn't it get better?
Yes.
Yes. Yeah.
Okay, so remember, we also need to be organized within the excuse me, within the paragraph. So when you're writing the paragraph, you can also do the same thing with subjective, objective, and assessment and plan. So we normally say what the patient was feeling and then what you found. Okay?
Yes, okay.
Right. And does he take any other medicines?
Yes, he takes some medications, but if I want to write these, my letter is over 200.
So I think you need to delete something else.
Yes, and also, for example, in the this sentence, Mrs. Zhu or Yaju has a history of hypertension. In the case that write the time of starting hypertension or IHD or acute myocardial, for example, 10 years ago, 5 years ago, and I omit all of the time. I
Do,
don't know. It is
uh,
necessary to write that or not.
not the dates really. I mean, does it make any difference how long he has had ischemic heart disease, hypertension, or acute MI?
No.
Yeah.
It's because just he's got CCF. You know that he has had it for a long time. So, and you're writing to a cardiologist.
Yeah.
Okay. Right. Okay. Let's look at another one. Um, okay. So what is this? So who is that? Who's
Me.
okay? Oh, any paragraphs here? Okay.
Oh, I think this.
I think, yes, before today and before regarding.
Okay. Dear Dr. Expert, I'm writing to refer Mrs. Karen and Mr. William Conway, a young couple with failure to conceive for about 18 months, for further assessment and treatment. Okay. On the request. Okay. So why semicolon?
Okay.
Okay. Um, I think it is not 18 months. I think it was 10 months or 8 months, something like that. Well, let's see. Initially, Mrs. Conway attended my clinic on her own. She reported that none of them had any significant medical problems, but their attempts for conceiving have been unsuccessful since May 2006 after she stopped taking the pill. Okay. We say the pill. They have not had a history of gynecological problems, they or
Both of them.
Gynecology.
well, the man wouldn't have any gynecological problem, definitely.
Okay.
Okay.
She have not. She has not.
Okay. I took a pap smear and ordered some hormonal blood tests. Is it important who did that?
No.
No.
Papa Smith was taken.
Okay, so if I say pap smear was performed or was obtained or was requested and blood test,
Was done.
okay, we can say pap smear and hormonal blood tests were requested, huh?
Mm-hmm.
Okay, so today Karen and William, okay, no, it's too friendly. Mr. and Mrs. Conway,
It's better. Okay.
Mrs. and Mr. Conway. We use a first name for children, okay?
Mm-hmm.
Right, okay. came to my clinic together. Karen's tests are normal. Her positive home ovulation prediction test confirms her ovulation. William states that he works away from home and it is not unusual that Karen has not conceived yet. Okay. Therefore, he is not interested in being investigated and he refuses to be examined. Finally, he agrees reluctantly to do a semen analysis. Regarding her medical history, William drinks their medical history. Alcohol 10 units per week. Karen is slightly overweight. So, what is her BMI?
I don't remember.
Okay, so it's actually this is judgmental language. So we don't say overweight. We say Karen's BMI is something. Okay.
Okay.
So I suggest that she lose some weight and take folic acid. Her sister has infertility. Is that important?
Maybe infertility, maybe familiar.
Is it?
Yes,
I didn't know.
I think some of disease can be familiar because
Okay.
of the infertility.
Okay. With regards to the conception anxiety, I would appreciate if you could see them for your advice. Although the semen analysis test result is not ready. Okay. Right. So, are you sure it's 18 months?
Yes, I think 18 months. I think.
I don't think so. Okay, let's see. What's the name? Conway. Sorry?
We can see the number of tests. We can check it.
Okay.
Dr. Madam. 13. 30.
30. Okay. I'm pretty sure it's not 18 months. I think it's 8 months or 10 months.
Sorry, doctor, can I ask a question about from the
About
point,
18 months, doctor.
Okay, go ahead, Faisal.
After doctor, is it necessary we use full stop?
No, it's not necessary. You can and you cannot. Both are correct.
Or after Mr. or
No.
Ms.
Both correct. Yes and no.
Okay.
Okay. Okay. In May 2014, she decided to get pregnant. Yes. And stopped the pill. This is 2017.
I think the task isn't it, doctor. It is 30.
Oh, so this is 23.
Yes.
This is another one.
Yes, I can see here. Yes, it is 18 months. It is right.
Okay. So there's different tasks then.
Yes, different tasks.
Okay. Okay, so that was 23. This is the another one, and it's the same name. Okay.
That's it. Yes.
Married for 3 years. And regular periods, BMI is 28. Okay. Only been trying to conceive for 18 months. She's very anxious and further investigation. Okay, the plan. Right. Okay. Well, I've seen 3 different versions of this task. That's why I apologize. Okay. That's the one. Okay. So, yep, that's quite good. What do you think we should add here? Something is missing, I think.
The name of the doctor.
No, actually, you said upon their request. Okay, I would say it actually needs to come here. Um, so you can say
Okay.
um, um, we have discussed um, that it might take longer to conceive, but with regards to their conception anxiety, I would appreciate if you could see them for advice, although the semen analysis test is not ready. Okay. Right. Well, that's good, I think.
Doctor, I have a question
Yes.
about today's tense. She write it in present tense. Is it correct, or we should use simple past?
Both are correct. I mean, basically, maybe they're still there, so that's fine. Today they have come here and they're sitting here now, and they're pushing me to make a referral. Okay,
Okay.
that's fine. Both are correct. You can say earlier today I saw them, but or maybe I see them now. They have come to my clinic. Right. Okay. How many words? 223. Is there anything we need to omit? And is there anything you think is too much?
You said the sister must be her
Okay.
sister.
Okay. And how about the um,
Work away. William
yes,
stated that he walks away.
yes. So I think that is really not necessary. And you say Karen tests are normal, and she has a positive home ovulation prediction test. Um, okay. Um, right.
Doctor,
Uh,
what about therefore?
there. Sorry.
Therefore,
The next sentence after we deleted. Therefore,
Uh,
he is not interested in being investigated and refused to be examined.
okay. Yeah.
We can
Uh,
say all of them in one sentence. The
um,
man is
okay.
reluctant to do it. Semen analysis.
Um, well, he is obvious. Yeah, we know that Mrs. Mester Conway is not interested in being investigated and refuses to be examined. Okay. Finally, he agrees reluctantly to do a semen analysis. Okay. Okay. So, do we need finally? Mm, I don't know. I don't like them. 197 words. It's better now.
Mm-hmm.
Okay. Uh, I think it's good. Uh, okay. That's good. Right. Let's go to one from. Okay. What's that? Kathy Jones. Single woman whose signs and symptoms are suggestive of suspected ectopic pregnancy. Okay. Now, could I ask you why you need this? Um, 1, 2, 3, 4, 5, 6, 7. 7 words. Why do we need that?
To write a beautiful sentence.
Uh, is that is it ugly now with suspected ectopic pregnancy?
I don't know.
Okay. And what is the reason? What do you want from that doctor you're sending this?
For further management.
Okay, thank you. And is that urgent or emergency?
Emergency.
Urgent was
Emergent.
more critical. Emergent.
Okay, so for, shall we say emergency management? Yeah.
Yes.
Okay, agree. And when you send a patient to hospital, do you actually talk to them?
Yes, in this case note, they have talked with each other.
Okay. Okay.
I
So,
don't know if I should say it or not.
sorry. We need to
Uh,
speak anyway.
I said that I wasn't sure if I should write that or not.
Yes, we
Okay.
do. Yes, it's
So
an
the
emergency.
social.
Yep. Uh, well, for emergency cases, we need to talk to the admitting doctor and we need to give them a heads up. So they need to be expecting the patients. Okay. And do we have a date of birth for Kathy Jones?
No.
No. Okay. Is it important she's single?
Um, somehow, yes.
Somehow, yes. Okay.
No, she's not married. She has boyfriend.
Okay. And would that make any difference?
In
No,
Iran,
no.
yes. In
In Iran, yes, no. They would ask consultation for مشاوره اخلاق، مشاوره قانونی، پزشک قانونی.
Okay. How about
Yeah.
Brisbane? Is that a problem in Brisbane?
I don't think so.
No.
Mm, okay. Well, you might say, yeah, yeah. Well, single woman or single lady, or we can say a 25-year-old lady. Okay. Anyway, you say it is relevant, so we leave it there. Yesterday, Miss Jones had presented to my clinic with a complaint of lower abdominal pain, which had been worse in right iliac fossa. She had not had, she had no fever, okay, um, but had severe tenderness in the vaginal examination. Uh, we don't need there in vaginal examination. On review today, the pain has worsened, okay, since last night, which was accompanied by some light bleeding. Okay. Now, you know which defines the previous word. Okay, the last night which. Um, Therefore, we don't say which here. We say and it was accompanied by some light bleeding. Okay. On examination, she had severe tenderness in the right iliac fossa with rebound tenderness and guarding. Her urine dipstick was clear. Her pregnancy test is positive, and this is her first pregnancy. Okay, right. So why did you send her home yesterday?
In the case note says that we said her come tomorrow morning for a blood test. I didn't write that, and I said
Okay,
for yes. The
okay,
last day she was better than today.
okay. But she's been worse
Yeah,
today. But she did
yeah,
have tenderness, severe tenderness yesterday. Okay.
yeah.
And but that is a problem. I mean, that's not something we should do. She has started a new relationship since 2 months ago and is on the progesterone-only pill for contraception since then. She okay. She's had irregular bleeding since starting POP. Consequently, she's unsure about her last LMP. Okay.
Yeah.
Um, please note that. Okay. We don't use comma after note. We say, please note that she has a family history of deep vein thrombosis. Okay. In view of the above, regarding her suspected ectopic pregnancy, I appreciate your urgent assessment and management. Okay. And
Emergent.
yeah, I think, I mean, I don't really actually like this when you say in view of the above, because, and please keep me informed of the outcome. No. Oh, obviously they will.
Doctor, in plan it said, in case not, she asked from the doctor to keep you informed.
Okay. Um, okay. Yeah, you don't need to say that, and you cannot order them to do that. They will do it anyway. That's the system. But even if you want to say that, you don't say keep me informed. That
Okay.
doctor is not your servant. Okay. You
Yes,
say
yes,
I would appreciate if you could keep me informed. Okay.
yes.
Right. 184 words. Good. And in view of the above, I mean, I would usually say give a detail, give your assessment, okay? So you said the situation, the background, and then you need an assessment. So in view of the above, I think I suspect she has ectopic pregnancy, okay? Um, 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 I suspect she has ectopic pregnancy, and I would appreciate your uh, uh, early or your early assessment and management. Okay. Right. Good. Okay. Happy. That's good. You're getting there.
Sir, yes, I was unsure about my tenses. Were they okay
Yep. Um,
here
you just had a
during
few
this?
mistakes here, but that's fine.
Okay.
Right. Okay. So what is this? Uh, Mr. Darren Walker. I think I have heard of him. I'm writing to refer Mr. Walker, a 40-year-old married man with 2 children. Okay. Complaining of difficulty in urinating for urgent assessment and management. Okay. Um, is this relevant?
No.
Okay.
No.
Who was that said no?
Me.
Who is me? Okay. Uh, okay. A 40-year-old gentleman complaining of difficulty in urinating. We don't actually need in difficulty urinating. Right. Um, for urgent assessment and management. Okay, let's see why it is urgent. Mr. Walker came to see me yesterday with complaints of discomfort, urinating, upon examination. His DRE, what is DRE? Sorry.
Digital rectal
Rectal
examination.
examination showed hardening and enlargement of prostate. And PSA test was 10. PSA, his PSA test result was well, it's a good idea to write the what 10 is, okay? Is that millimole or is it
I don't know.
okay? He had reduced the smoking to 10 cigarettes per day and had been attending gym twice a week based on my advice. His weight was 77 and blood pressure was 145/80. Okay. Um, is this background information or is it about today?
Not today. Actually, yesterday. I think.
How about this, reducing smoking and this?
I can't remember. I write it 3 days ago.
Okay. Okay. Right. So I would say probably about a month ago, Mr. Walker had come to see me. Yes, had come. Okay. Because
Had
you're
come.
saying before this.
Yes.
Okay. For a routine checkup, his weight was 85, BP was 150 over 60, 165 over 90, and urine analysis was normal. I recommended that he lose weight, stop smoking, and requested a PSA test. Uh, because he insisted, I think. Is it?
Who insisted? Who?
Why did I request a PSA test?
I don't know. The
I
case note was the.
I think he insisted on PSA. I think that is the case. But anyway, because we don't do that regularly as a screening test. Mr. Walker had been smoking 20 cigarettes per day, trying to stop it. He drinks 2-3 beers a week. Had not been doing regular exercise. He had reduced smoking. Okay, I just take his out. His weight was 77 and BP was 140 over 80. His father has been diagnosed with prostate cancer at age 61, and he is 71 now, and his mother is hypertensive. Is that important? Mother is
No.
hypertensive.
No.
How about the father who actually had prostate cancer? Is it hereditary?
Yeah, it can be.
Prostate biopsy. Okay, right. 158
Why,
words. Yes.
why she write blood pressures 2 times? I couldn't get it. His weight
Uh,
was when his weight was 77.
okay. Uh, answer.
I think in two separate visiting mentioned the blood pressure. One was normal and one was high. It
Okay.
wasn't in back uh, family back history.
Okay. Darren Walker. Darren Walker. Let me see if I had that.
I
Uh,
think it's number
10?
10. Yes, I think it is number 10.
okay. Right. Let's see. Now, where did it go? Okay. Right. Have a look at this. Okay. I'm writing to refer Mr. Darren Walker, a 40-year-old gentleman with urinary discomfort and a raised PSA, urgently for your assessment and possible prostate biopsy. Mr. Walker came to see me yesterday with urination discomfort. His PSA, which was requested about a month ago, was found to be raised at 10. On rectal examination, I could feel a firm enlarged prostate. In a regular visit a month ago, he had a raised BP of 165 over 90. His BMI was raised and he smoked 20 cigarettes per day. We agreed to monitor the BP and reduce smoking. Due to family history of prostate cancer in his father at the age of 72 and smoking history, we agreed to check PSA, though he had no symptoms. With regards to the new urinary symptoms and family history, I suspect he would need further assessment. I would appreciate your urgent attention and seeing Mr. Walker on an urgent basis for an assessment and possible biopsy. Should you require further information, please do not hesitate to contact me through the direct phone line. Okay. How was it?
It was good.
Okay.
Here we can understand why he said about weight and blood pressure.
Okay.
I think he made up something.
Which one?
I don't remember. It is number 11, I think. Darren Walker, yes.
Yes.
It is a small case note, and we have only two visits.
Yeah, I think something is missing here, but yeah, but
Yes.
the checking PSA, maybe that's the one you say is made up. But we agreed to check PSA. Is that he had no symptoms? So it was requested a month ago, but he had no symptoms. Yeah. So why did
No,
we?
and there is no requested 1 month ago, I think. I don't think. We have only two visits, and yes, I don't know. Okay.
So
Thank you.
so the PSA was checked when?
The PSA.
The result has arrived today. Are you with
Yes.
me? Yeah, are you with me?
Yes, yes. We have two visits, okay? One in 9, 7, 12, and one in 14, 8, 12. Okay?
Okay.
And
Yep.
in 14, we have PSA reading 10.
So the result is here now. So it has
Yes.
been requested before.
Yes.
Yes. Okay. Right.
Is it necessary to mention that we require PSA before and we have result now? I don't think so.
Okay.
It is obvious.
No, it's not obvious. Why do you do PSA in a normal person?
I don't know why. Maybe because her father has prostate cancer.
Okay. So.
I think.
Okay. And would you do that?
I don't do that.
Right. Okay. Basically, PSA doesn't have a good predictive value. We don't use it for screening. It is not used for screening. It is used for monitoring the size of prostate, or in those who have prostate cancer. Okay. Now, a raised PSA of 10 would actually cause a lot of problem for this man, because he needs to have a prostate biopsy, and in fact he might not have any prostate problem. Okay. It's because it has a lot of false positive. Basically, yeah, we don't do it as a screening test. So you need to explain why you have done this test, and it's because he requested it. Okay. He had no
If
symptoms.
it doesn't mention in the case note, I have write it because of the patient want this.
I think it's yeah, as you said, this case note is not complete, and I think it's probably been mentioned, but because we don't do PSA tests for screening, and if you send this letter to a urologist, they get very angry. They say, "Why the hell did you do a PSA test for a normal person?" Okay.
Yes. Yes.
So, okay. Right.